Don, good to spend some time with you. We're going to have some fun talking to our audience here about lots of different topics related to healthcare. So maybe I'll just sort of jump us into the beginning of this a little bit with the idea of establishing that this is the first time we're doing one of these. We're going to talk today less about specifics about One Up Health. I'm the CEO of One Up Health, Joe Gagnon. Don Rucker is our Chief Strategy Officer. And, in our conversation, we're going to explore, how our industry is going to transform, a role that we'll play in that, some big ideas, and sort of tap into some of your experience from when you were the national coordinator, and just, see if we can do for this health system, broadly speaking, what we've all been hoping would happen over the past few years. So why don't we start with a bit of a worldview? From lots of conversations you and I have had, there's this worldview that says we're on the cusp of some significant shifts in healthcare broadly. Which one is that the public and the role of consumer mindset that comes to play is going to make for a more accountable and a more effective industry. We'll move into a little bit later on the relationships between payers and providers and the implications to them, and then maybe even talk a little tech for a few minutes. But why don't we start with, this sort of this world where will we move from patient or member to customer, and what are the implications of that in the industry?
Yeah. I think we all have a sense that there's something missing in healthcare. It's not a consumer-friendly experience. And the more you've been a patient, the more you're sort of aware of that. And so if you try to, figure out reasoning by analogy, as they used to say in school, whatever that meant, to the rest of our lives, I think what you're going to see in healthcare, fueled by, frankly, the public dissatisfaction. It's an issue in most elections somehow, maybe not all, but many elections. And so that means there's a constant political pressure, both on the agencies and on Congress and, the executive branch to change and fiddle with the laws and fiddle with the rules and stuff. I think what you're going to see as we look at this, though, and looking at the rest of our lives, it's going to be way more connected, right? We are, now digital, our smartphones are a part of us, really. And I think what you're going to see is future clinical interactions are going to be about constant data coming in and out of our smartphones and us as patients, right? So that might be conversations fueled by apps, alerts, reminders, that type of world. It may also be either separate from the smartphone or with the smartphone, what's called the Internet of Things. So whether that is sensors for your heart rate, I think I have a product here that
both. I got one right here too.
To manufacturers that monitor heart rates. Whether that is, for diabetes, for breathing, for gait, for neurologic illnesses, whatever those things are, it's that Internet of Things. So I think we're going to see the consumer interaction with care being much more digital.
So it's really interesting because I think there's a lot of this that we feel, and it's probably because in many of the other parts of our lives, we've been affected by consumerization.
Yeah.
The travel industry, we don't have to go to the travel agent anymore to get a seat on an American Airlines flight. We can just go on our phone and see that inventory. We don't have to get in our car to drive to the store. We can buy a medium t-shirt from REI and it'll be there tomorrow if necessary. We have Amazon that's redefined and Instacart that's redefined our interaction with anything as simple as groceries. And so we've come to sort of this world where that is somewhat of our expectations, but healthcare, and I would often say education, are operating off of systems that were designed probably in the 1800s, where, there was one book. That's why we had a one-room schoolroom, right? Everyone had to go there because there was only one book. Now we got the digital world and we're still sending kids to a schoolroom. And in healthcare, it was you had to go see the doctor because that's the only way care could be administered. And they created this one document called a medical record that was supposed to have all the information about you. And it seems like many of these systems in health did not contemplate a truly digital world that's empowered in a consumer world. And interestingly enough, like we don't really pay directly. So it still has some work to do, but it looks like it's the early stage of what we've gone through in other industries. Would you say that's a good characterization of where we are and then what's possible?
Yeah, I think when you look at it, it's interesting. Just as we are recording this last week, there was a request for information from one of the federal agencies on prior authorization and the massive provider payer patient dissatisfaction with just that one thing. I think when you take it up a level, the conversation that we need to empower consumers means we have to have a different conversation in the provider payer space as well. Today, utilization management, whether that is prior authorization or the quality measure game almost, if you will, or things like, narrow networks that do utilization management by great restrictions on where we go. All of those are tremendous consumer dissatisfiers, right? They're just tremendous. That whole bandwidth of communication is just, every time you look at it, it's a big dissatisfier. And I think modern technology now allows us to think, what would be a better conversation between providers and payers that is, maybe natively digital, real time, continuous, less intrusive, uses all the information that we've already captured as opposed to re-entering it in a form. And folks, entering information from the electronic medical record in a PDF is not what we're talking about with digital. Here, we're talking about something vastly different.
Yeah.
So I think we have to absolutely think about rejiggering that conversation. And frankly, I think the people who succeed in reimagining that conversation and are first there are going to be the winners. That has been the case in every other part of this digital app world. And we know those winners because they are today household names.
Yeah, I think we all feel like data matters to our lives in ways that we could never have imagined,
Yeah.
Whether a marketer's using that to send us a custom message, whether we're using it for banking. Uh, and then in health, you would think that timely data is maybe the most important. Like if you have an issue in your blood test, you would want to know that instantly, right? If you were trying to get a more comprehensive view of how payment history should affect current payment, you would think that more data would be better and timely data. And so it seems like there's a lot of data in the health system, but not acted on in a very timely way or comprehensive way. Is there something that's happening in that space that we should all be thinking about, and how that would advantage us both as the consumer, patient, as much as the healthcare provider or the payer?
Yeah. We don't have a lot of real-time data in healthcare, interesting enough. Now, if you're sitting in an ICU, wired for sound, as it were, that's different. But in our lives as consumers, as we go about our business, none of it's real time. I mean, we're sort of socialized to wait for the test results. And, the bill is going to come sometime. And it's the height of great performance as a CFO in a health delivery system if you can get your AR days down to 50 or something, or 45, right? Days, right? Like where else would that be?
Yeah.
Where else would that kind of performance be really acceptable? The challenge is in healthcare, for various reasons in the past, we haven't had the kinds of platforms that support that. I mean, when you think of your provider world or your payer world today, and I'm talking about, big delivery system providers and, big payers, they're typically a mix of a transactional system, right? The quote unquote EMR. And then there's an analytic system, often called online analytic processing, or OLAP, that is a relational database sitting behind that. And ditto for the payers, they have claims analysis, right? The claims edits. And then they have, their analytic frameworks. And that's sort of what it is today. However, when you look at what is really needed for that consumer experience we've talked about, you need two very different things that those classes of systems are just not designed to provide, fundamentally not designed to provide. And for that richer real-time consumer experience, you need lots of real-time analytic power, right? You have to be able to calculate the digital product instantaneously on demand. So it even goes beyond, serving an ad because you searched for something 10 minutes earlier, and then miraculously, as you're watching YouTube, the ad appears. Right? It even goes beyond that. And you also need, of course, then really powerful real-time APIs to serve, the combination of analytics and whatever data fields you have. So you need an absolutely different infrastructure as you look today. Hard to imagine that scalability and performance in that would run on anything but native cloud.
Yeah. I know we're going to get into some of these topics in a deeper way in future sessions of our series, but if we start to open up this data, there's always this worry about privacy and security and making sure that it's used properly, because we love the idea of maybe that data could help me, but is it going to be used appropriately? Thoughts on where we are with the data part of this and security and privacy?
Yeah. I think, my observation of being asked probably thousands of questions about this in my prior role, frankly, is, and it took me a while to think about it, but I think, first of all, we have to separate security and privacy. And there are many, many definitions of security and privacy, but I would say operationally, security is protecting things from people that have just no right to the data whatsoever, right? So somebody hacking in from, a different country, or outright data theft. And we have pretty good mechanisms to do that. I mean, you got to protect servers, you got to protect passwords, but we know the drill, and we know how to do that. It can be painful at times. We know how to do that. The much more complicated issue is privacy in healthcare. That really is the rub here. Now, a lot of times our privacy concerns are really about insurability and being able to get insurance, when you actually dig into a lot of why people don't want to, have their information out there. And so when you look at privacy, we have to think richly about things like identification. We have to think about, the related authentication, authorization, consent. So who are you? What do you allow others to use of your information, and what have others given you, right? So that would be parents, children, caregivers, those types of relationships. When you look at all those, we don't have great mechanisms, because our data representations, again, we talked about those transactional systems and the analytics set, they're not designed for granular privacy. It was just never a thought. And so they're just not designed for modern concepts of privacy. This is bedeviling for folks in substance abuse and the 42 CFR regulations on substance abuse, or emancipated minors, or birth control. There are many issues, varies by state, and you have to follow those state laws. And in all of those, you want granular control of privacy. And interestingly enough, I think part of what appeals to us about the One Up Health stack, and obviously we work here, so it's self-serving, but it's the first time I've ever seen field level security for every field natively built in. That's a mouthful, probably more than a YouTube type of video, but it's worth considering how you fuel privacy in the modern digital world and do it in a way that doesn't create more consumer pain.
Yeah, I think, what we would believe and want to believe is that, if we understand what the problem is, we could solve for it. Number two, if you get enough benefit, you're willing to share. I mean, we share data every day.
Right. Our credit card, our cell phone, our
right?
Search history. Yeah. Every single, or geolocation, every single thing is known about us.
That's right.
Right.
Where you've been, there's not what you did.
Yeah. There's not a thing that isn't known about you almost.
But we feel like we get enough value so that we don't object. So I think we probably could solve for this with some good thought. And we're gonna probably wrap up in a couple minutes, but one of the things to think about, Don, as we, endeavor down this series is trying to sort of imagine this future state world, right? Where, our lives, we're living longer, better, happier, more productive lives. It's costing less, that we've made healthcare somewhat democratized. So it's not just for the privileged to get good care, it's everyone. We know that the majority of the system is funded by healthy people for the people who aren't so healthy. We want to do all of the right things. And at $3.8 trillion, we probably have enough spend. But this is a big system and it's complicated with a lot of stakeholders. And give credit to you and the government when you were there for making a push to say there's going to be some standards that we think are going to set a foundation for the day when we all get our head wrapped around we can do this better. Like, we can't accept it the way it is, and we're not going to. Certainly at One Up Health, we want to be a contributor to building the infrastructure first level, which gives you that ability to rethink. Then the application level, that'll give you the ability to communicate and connect. And then that analytic level to get some insights and deliver better cost and better care. So maybe we'll just tease it out here with a few things. There are some standards that have been put together that are going to allow us not to have arguments about things that sort of shouldn't matter, right? Like, who cares how data transmits over a phone line? We just wanted to do that, right? The same thing with, we don't know what standards or operating system are on our phone. So just give us a quick rundown on some of the standards that we're going to end up talking about in future sessions, all in the context of really transforming the industry and giving them the opportunity to just make it better for all of us.
Yeah. Well, that was the data standard that we're talking about here is FHIR, which is, the acronym is capital F, capital H, capital I, capital R, Fast Healthcare Information Resources. Nobody even knows, good acronyms, nobody knows what they stand for anymore. So you have to think, what was that again? So why FHIR? Well, I think it's really an evolution of about 30 years of work on knowing what works in healthcare and what doesn't. But the real revolution of FHIR is just layered straight on top of the modern web JSON data standard, JavaScript object notation that powers essentially every app on your smartphone. I mean, just for folks, pretty much every app on your smartphone actually is just a little shell that communicates with backend servers, and it's using JSON data to do all of this analytics. And that's what we've just been talking about, right? Richly powerful APIs with real-time backend analytics services. That's exactly the nature of the architecture we've been talking about to have consumer friendliness in healthcare. And when it's sort of hard to imagine anything else when you look at the technical stack, the capabilities. You can read it with human eyeballs. You don't need to be a programmer to do it. You can leverage the entire learning of the entire software industry globally to use these things. So it's not just healthcare bespoke things. and it really allows modern computing behaviors, right? So we talked about the payer, provider, what those conversations might look like in the modern world. They're going to be much richer. Nobody's going to be filling out PDFs and then sending them by fax, right? This is all going to be automatic in the background, right? With just the critical point of service being the only thing that is exposed, the same way as we see it for every other app that we use. And when you just have that critical point of service or activity exposed, and compute underneath, hidden on all of the other things. Obviously, one of the questions is, what kind of platforms would actually allow you to do that with the scale and power? And obviously, that's been quite exciting for us at OneUp to work on a platform that we believe is unique in that, closeness to modern data, big data. Big data is velocity, variety, and volume, right? That's the classic discussion of big data. And each of those things then sort of you can walk back to a platform. And whether, in the future, providers and payers use our stuff for other things or whatever, but somehow they're going to have to come to something that has huge volume, scale, and speed, but also allows very fine-grained atomic variety to have these rich, personalized behaviors. People all talk about individualized healthcare, personalized healthcare, but you need a totally different architecture to do that from what we have. And so that's part of the amazing journey that we're all collectively on.
I think it's exciting, Don, because one, basically acknowledging the technology's here ready for us to use. We have some really good ideas collectively in the industry. We have a welcome consumer who wants it to be better. I think the healthcare practitioners would be excited about it as well. So now it's about getting on this journey and figuring it out, making it real, bringing it to life. That's what we're going to spend, the future on with you, is talking about how we bring this to life, both through some of the work we're doing in the industry more broadly. We'd love to hear from anyone who has any questions they'd love us to touch on. And, we'll be back with you very soon with our next episode. Thanks for watching.
Thank you.